Welcome back, everyone. Next up, we have Mitesco Inc. It trades on the OTCQB under the symbol MITI and is building a next-generation healthcare solution, providing healthcare services and technology to make healthcare more accessible, higher quality, and more affordable. Please welcome its CEO, Larry Diamond. Welcome back, Larry.
Thank you for having me.
All right, the floor is yours.
Excellent, thank you. As we get started, first off, I'm Larry Diamond. I'm the CEO of Mitesco. I want to remind folks of two things. First off, we will be discussing forward-looking statements. So there is currently a warning on the first slide here. I'd ask you to take a look at. The second item that's important to understand, I am a little constrained about what we talk about today. We are in a quiet period as we get ready for uplist. We filed our S1 and an amended S1, and those are available on our website as well as out at Edgar. So we're going to go ahead and get started here this morning. For all those who are new to Mitesco, the organization is focused from a mission perspective on really improving the quality, reducing the cost, and improving the consumer experience. What's unique about our business is that every single American has experienced healthcare in some way, shape, or form, and they know the deficits of the system that we are experiencing today. Healthcare has evolved rather significantly during my lifetime, and I think all of our lifetimes, from going back the old days when my PCP took care of everything, my primary care doctor, to now we have these mega health systems, and it is very much a business, and the business continues to evolve. One of the most notable things we've seen, and it started, I think, first probably in plastic surgery, and it's now evolved into really every aspect. Pharmaceutical does direct marketing and advertising to consumer, and you ask yourself why. It's with healthcare costs being so significant and the consumers paying such a large portion of the healthcare dollar out of their pocket, even if they have insurance, healthcare has become a consumer product. The consumer is raising their hand and saying that they want to be a participant in the decisions as to what happens to them. And they're not satisfied with the way healthcare has been delivered to them. The market research is pretty significant in the fact that they're very dissatisfied. They want something that's more personal about them, and they want something that's very convenient. And so we're shifting primary care from a focus on sickness and traditional services to one on prevention and continuous relationship with your clinician. Why is that important? Having a relationship with your provider is essential. Someone that you can trust knows your history. There's too many services out there today that are willing to solve your earache or your sore throat, give you a vaccination. The challenge is some portion of the time, without knowing your medical history, they may not be giving the best possible care. And that is why primary care is so important. The challenge in America, as AMA says, that there's a shortage of about 25,000 primary care providers in America today. And as a result, it's one of the reasons we run over to the various urgent care centers or the retail clinics that are at pharmacies and things like that. The problem is they're not really solving our problems or helping us solve the problems. They're really just solving the immediate issue that's there. And so we need to focus as a system on prevention. Healthcare today is almost 20% of GDP. We cannot continue to spend this portion of our gross domestic product on healthcare as a country. And as a result, we have to get control of it. And that's why primary care is so important. It's the one thing that if you can prevent a disease from happening or exacerbating, you can eliminate that cost. It's not putting off, it's not delaying, it's eliminating. So to that end, we are opening clinics. We have 6 clinics that are open now. Over the next 3 years, we'll open a total of 50 clinics. It's under the brand name, The Good Clinic, and it's using an innovative approach. It's using nurse practitioners as the primary care provider. And the reason for that is physicians, when they come out of medical school, really don't want to get into primary care. They can't earn as much as they would if they were in a specialty practice. And as such, nurse practitioners have started to enter primary care. Now 25 states actually allow nurse practitioners to practice on parity with physicians. So they can do everything a physician can do. And so what's also unique is that a nurse practitioner has the ability when they enter practice, because they typically start as an LPN or an RN, when they get their doctorate in nursing practice, they actually come with, on average, somewhere between 9 and 12 years of hands-on patient experience. So coming out as a nurse practitioner, they are very experienced providers of care. For us, the advantage is that they get paid a whole lot less than a physician. So they get paid about 40% less. We get reimbursed about 15% less. And as a result, there's about 25% extra margin in the business as compared to a traditional primary care practice. So as we look at what we're going to do here is we're going to grow clinics organically. We are looking to acquire clinics around the country, and we will look to fold them into the good clinic practice model. And then we're also looking for technology. Technology allows us and allows the clinician to increase their breadth and the time they can spend with the patient without actually being with the patient. So we're always looking at innovative technologies that we can embrace and bring into the practice as we work with a consumer. You may ask, well, who are you looking at? Well, it's important to understand how we spend on healthcare. In America, about 5% of Americans use 55% of the dollars. The next 20% use about 25% of the dollars. So it leaves 70% of Americans who on average are using about $2,000. They don't tend to have very strong relations with their providers. They could have chronic illnesses, they could be diabetics, but on average, they tend to be pretty healthy. And those are the people that we can go in and we can target and bring into the clinic and deliver something that's unique and different that they have not experienced. Part of that is we spend time with our patients. We're not beholden to a healthcare system that is using primary care to filter high-cost events that they can do angioplasties and stent placements and things like that. Our simple goal is to keep patients healthy, stable, and in place. As a result, our target right now is to have an average appointment time of about 39 minutes. So we're spending the time necessary to really understand who that consumer is from a psychological perspective, from the stressors of life, and from a physical health perspective. So it is primary care with behavioral health, with dermatological services, with Eastern and Western medicine. So it's that combination that really allows us to understand and talk to the patient about how they can better manage their lives and achieve a healthier status, improve their quality of life. As a part of that practice, if you look at what traditionally happens in primary care, the person sees their primary care provider on average about 1.5 times a year. We actually will see a person probably about 4 times a year. And we're using telehealth. And so it may not always be in the clinic, but it will give us the chance to help them with the care plan that we co-develop with them and set out goals on how to improve their life. We're able to touch base with them, help them move along that path of improving their care. Now, one of the reasons we're so fortunate to be able to be here and helping America really change the way primary care is practiced is being able to draw on the experience of the team that is managing the Good Clinic. We have Michael Howe and Kevin Lee Smith, who were early folks over at Minute Clinic, which is now owned by CVS. Michael and Kevin built that business from 9 clinics to over 500, sold it off to CVS. They know how to quickly scale a business in the healthcare space, how to work with clinicians, and how to deliver a consistent product to the consumer. We also have Brad Case, who's the president of the Good Clinic. Brad has worked at United Healthcare and Bright Health and in the home care space. And again, he stood up the primary care business for United Healthcare. And so these 3 folks who are leading the team have been there, they've done it, they've scaled businesses, and we're fortunate to have them here leading the team as we stand up this consumer-focused primary care business. Core to that is, how do we do it? Well, first off, this is a community amenity. We're locating the clinics in densely populated neighborhoods. In most of our clinics today are on the first floor of high-rise apartment buildings, and the landlord actually views us as an amenity to the building, just like the pool or the gym. They think it communicates a message of a higher quality of life if you live in that building. And so they're giving preferential treatment, they're marketing to their residents, and really have nice partnerships with our landlords. As we mentioned before, it's a different approach. It's that whole person approach. It's not sick care. It's about understanding the person, mind and body in total, keeping it convenient so you can get in same day, next day. The internet has changed the way that we want services. And so we've modified our model. Instead of scheduling out months and months in advance, we really keep a lot of appointments available and encourage people to just pop in when they have a question. We don't want a big barrier. We want to be there when the person needs us, because in healthcare, delays in care increase the cost of the intervention. And that's what we want to make sure that we're avoiding. If there's a problem, we want to know about it right away so that we can help and pursue that healthier person that that consumer wants to be. Operationally, when we think about the primary care visit, instead of the old way of seeing a person one time a year, we want to see them more than one time a year, coming in not just for sick visits, but for wellness visits, and working against their plan that has been created. Needless to say, this is going to create more revenue for us. We have a lower labor cost, which is a huge advantage in the marketplace. And today, there are currently 30,000 nurse practitioners that are graduating every year. So there's not a shortage of nurse practitioners out there, which helps us and actually gives us the ability to pick and choose the best of the best when we bring them on as employees. The other part of this, just like any consumer product, we've actually cultivated that consumer experience. We've planned out and we're training our nurse practitioners, our LPNs, RNs, our client care coordinators as to the experience that a consumer is supposed to get when they walk in that door. The look and feel of every clinic is very, very similar. So just like any other consumer product, there's a defined experience that we're going for. And so we have built that here. It's a three pillar approach to that. And it really is focused on making sure that we're helping the person be the most they can be and have a healthy lifestyle. To that extent, here's a picture of what a typical clinic looks like. And you'll notice in the front, we have product that we have out front. One of the things that we've recognized is the consumer is saying they want to look at both Eastern and Western medicines. They want to understand what vitamins or supplements are alternatives to keeping them healthy as opposed to just using prescription medications. And so we actually offer products that we have evaluated and reviewed in the front of the store. And what's interesting is that that's actually running a little ahead of schedule from a pro forma perspective as to the number of consumers are choosing to buy their supplements, vitamins, vitamin D and B and things like that right at the front of the store. We want to make it convenient for folks to be able to be healthy. So not only is it from the products they can buy, but also being in these communities so they can just stop in and they can have questions answered very, very readily. I would encourage you guys to go out to Google and see what consumers are saying. It is profound how the consumers are reacting to us. We have 5-star ratings across all our clinics at this point. ZocDoc, all our clinicians are rated 4.9 or better. So the consumers are very, very positive about what we're delivering, and they're recognizing that it's different than what they're experiencing in the market previously. What I did here is I wanted to show you how we're growing. Just like any consumer product, getting sampling, just like at Costco when the folks hand out samples, we need to do the same thing. And as a result, we're able to take advantage of the fact that we have a pandemic going here, and we've been doing a lot of vaccines and COVID testing. Those are typically 15-minute appointments, and you can see it's been a big part of the type of exams that we're delivering. And you can see that we have, obviously other length of appointments, and there's different things that you do in different appointment lengths. So we're off to a good start in that, but that trial is really critical because what that allows us to do is it allows us to develop the relationships. It's our sampling. And so the vaccine visits are bringing people into the clinics, but now we're seeing the number of office visits increasing as directly related to the number of people we've seen with regards to the vaccines and immunizations and the testing. And so you see here that for the third quarter, fourth quarter, and first quarter, there's been a nice increase in that dark green box, which is the office vision portion. So it's all the appointments greater than the 15-minute appointments. So those are growing very nicely. The other thing that corresponds to that is the total minutes of care. As I mentioned before, so many primary care businesses and practices focus on that 15-minute appointment because they're really just looking for sick people that they can push in for an MRI, a CAT scan, go on to a specialist. We're really looking to be able to help a person stay healthy. And what you're seeing here in the total minutes of care, how it's climbed each quarter, is that we are now converting people from that first little short visit into a more in-depth wellness visit, where we're able to put together that co-developed wellness plan to help the consumer. As you'd expect, as you start to build relationships built upon our practice, we're starting to see the telehealth visits increase. Now, remember, each one of our exam rooms is fully telehealth enabled. So whether the person is in the clinic and in the exam room or whether they're at home and we're working with them, there's really no difference from that. We just can't touch the patient. But what we're able to do is we're able to follow up. As I mentioned, we're trying to have more than just that annual visit. We want to have a plan on how to help people stay healthy. And so those telehealth visits are very key to that. We can do the urgent care visit. We can prescribe via telehealth, but we're really focused on how do we work with people over time to help them improve their lives. And you're seeing that here in the increase in telehealth visits, that's happening. Now, part of the challenge as we enter a market is we have to get into all the insurance networks. And, I think previously we've talked about the fact that on our pro formas, we expect 70% of our revenue to come from insurance payers and the other 30% to come from consumers. And that's a combination of people who don't have insurance and are coming in because we have a radical thing. We have a price list that we can give someone and they can come in and they can see, I'm just going to pay cash for it instead of hitting my healthcare savings account. Or I don't have insurance and I want to pay for it. How much is it going to cost? We can tell them in advance. But here gives you a feel here in Minnesota, the insurance accepted on the left-hand side of the screen, United, Blue Cross, Medica, Humana, very big players. And we're still in process with Health Partners and Cigna, UCare, and the Minnesota Department of Health. These will all come, but our growth is constrained initially by getting into the insurance network. So as we get into Colorado and expand there, we first have to have our first clinic up and running, and then we can apply for participation in their networks. And so we have 2 clinics under construction in Denver. As soon as the first one's done, we will begin the application process out there. That can take somewhere between probably 45 to 120 days to get into network. So when you think about our anticipated locations, right now we're building out a network here in Minnesota. We have 2 clinics under construction, as I mentioned, in Colorado. We have 2 more clinics that will sign leases on in the next couple weeks, we anticipate here for construction in Minnesota. And then in Colorado, we have a lot. We have 5 to 8 other leases that we are in negotiations and expect to bring in here in the second quarter still. So there's significant growth plans. After Minnesota and Colorado, Arizona and Florida are markets that we're going to be headed towards. And then we will be looking for acquisitions. I don't know if you saw the press release yesterday that the state of New York went ahead and gave full practice authority to nurse practitioners. So New York becomes a market that we can take a look at. So really there's 25 markets today plus Washington, D.C. that allow nurse practitioners to have the full scope of practice. Even those states that are outside of that, it just requires us to have a QA process, quality assurance process, by a physician that sits over the nurse practitioner. So all states are viable for us, but we believe that going into the states that have full scope of practice for nurse practitioners is definitely where we'd like to start. As we've talked about before, when we look at healthcare, there's a lot of different components of it, and we're always looking for opportunities that can help our good clinic expand, become more efficient, more effective, and generate more revenue. So we're looking at all the different components, whether it's behavioral health or artificial intelligence, looking at the state of the art in telemonitoring. And then when we look at other clinics, we're looking for primary care clinics. There's actually down in Arizona, for example, there's a lot of expected retirements of physicians that currently are providing primary care. So that creates an interesting market for us, a market opportunity to not only build clinics there, but to acquire clinics in that marketplace. So we're looking around the country for where we could acquire clinics to accelerate the development of the Mitesco business. For those of you who don't know, the board of directors and the management team is very experienced in healthcare. Tom Broadmerkle, United Healthcare, and Coventry experienced Medicare commercial lines of business. Currently works. He has a advanced analytics company that focuses on healthcare. Dr. Faraz Naqvi, Harvard-trained MD and former McKinsey consultant, now one of the top money managers in biotech, working for Patek. Juan Carlos Iturregui is a Washington, D.C. attorney, deep experience in healthcare policy, has worked for 2 administrations. Sheila Schweitzer actually invented the first electronic claim in America. She's built and sold off 3 or 4 companies to United Healthcare, Anthem, Care Beyond, really understands the IT world and brings a lot to the table as a director. I have 27 years now in healthcare, started on Wall Street with Merrill Lynch. And then our management team, Phil Keller, CFO, deep public company experience. Jenny Lindstrom, our chief legal officer, comes out of Radisson Hospitality as the general counsel over there. And then Jessica Finnegan, head of human resources, comes out of the defense industry, and actually West Point grad, has worked in the military. So a lot of structure and experience that we have to scale this organization into a significant participant in the healthcare market. Before we do Q&A, again, I'm just going to emphasize the fact that healthcare has changed dramatically. It is a consumer product. Consumers are dissatisfied with what they have available to them today. You're seeing shifts. You're seeing healthcare organizations taking over malls, trying to figure out how to be more relevant in consumers' lives. Our model, putting us right in the middle of where people live, making it part of their life, we believe will contribute significantly to improving the life and quality and reduce the cost of care for so many consumers. Our model of using nurse practitioners, nursing is very much focused on having a longitudinal relationship with the consumer. And anyone with a chronic disease, this is something that they need. They need to have someone they can go to when small problems arise to get answers. And really, nursing aligns very, very well with primary care. And that's why we are focused on using nurse practitioners. The healthcare market will continue to grow. Population is growing, and unfortunately, America's getting sicker. And we have to do something about this. So there's no shortage of opportunity within the healthcare marketplace. So as we continue to take the 6 clinics we have and expand from there, there's a tremendous opportunity for the business to keep on moving forward. Obviously, we're seeking capital to do so. And the application of technology will just make us more effective, efficient in delivering a stellar experience for our consumers. I'm going to turn it back over to our facilitator to facilitate the Q&A process.
Wonderful. Thank you, Larry. We've got some questions for you. Okay, Gwen Carroll asks, what is the typical cost and build time of a clinic?
It's a great question, and we're very fortunate to have Michael Howell, who comes out of the restaurant industry. And he's brought a concept to healthcare, which is really exciting. In our clinics, it costs us about $1 million to build a clinic. That's construction, medical supplies, everything that we put into a clinic, technology. What Michael brought to us is this concept of a panel wall system. So we're using a dirt wall system. These walls come in pre-wired, pre-plumbed, with the wallpaper and paint already on them. So as soon as we rough out the shell, we're able to be up and running in about 10 to 12 weeks from building permit to first patient. So it allows us to get started very, very quickly. If you then dig in a little bit deeper on that, we typically, I think right now, are expecting a clinic to go from start to cash flow break even in about 14 to 16 months. So that's the target. On average, remember, we have two footprints. We have a 4 exam room clinic and we have a 6 exam room clinic. It's about 3,500 square feet. And remember, in comparison, most other primary care practices are using somewhere between 9,000 and 15,000 square feet. So we're much, much smaller. And what we're doing there is we're expecting a clinic to generate about $2 million in revenue and produce a 20% EBITDA for the organization. So those are the economics around the clinic business.
And Viola Morgan wants to know, how many clinics can you open in the next 12 to 24 months?
Yeah, so as we are thinking about that building process, because we have a very robust partnership with our contractor, we have a national builder, we have a partnership with Dirt Walls, we have a partnership with the supply houses on medical supplies. We've pre-ordered. And so our plan for this year still is to open 14 to 20 clinics this year, and then to open probably a similar number, maybe a little bit more, the year after. So our goal over 3 years is to get 50 clinics open.
That's a great goal. Dan Gonzalez asks, when entering a market, how long does it take to onboard insurance companies? And additionally, how long does it take to credential nurse practitioners?
Yeah, that's a great question. It is always a little bit different as you go state to state as to what you experience. But as I mentioned before, it's typically, it's about 90 to 180 days to get the insurance companies to get you on contract. It depends, when you're a smaller one-shop clinic, they're a little bit slower. As you grow, they're a little bit faster. And so we anticipate that things will get shorter as we become more of a national player. But, our first clinic in Denver will experience probably something what we experienced here in Minnesota. We opened the first clinic in February. It took us all the way to August and September to get the insurance contracts in place. After that, even if a nurse practitioner has practiced with a different company, with the same insurance company, was credentialed previously, that can take anywhere from 30 days to 90 days to get those nurse practitioners. Now, there's some things that we can do to get that nurse practitioner productive right away. As long as we have one of our providers that is credentialed, they can act as the supervising provider. And as a result, that nurse practitioner can go ahead and begin seeing patients and billing the insurance company. The supervising provider just has to review the record before they submit it to the insurance company. So really, as soon as we get that first contract, we're able to get into business pretty quickly.
Great. Julia McDonald asks, how many clients are responding to the product offerings in the clinic?
And there's so many ways to answer that. I think, at the year end, we talked about having about 2,100 customers that are on book right now. I guess unique patients in the system. We're sitting right now at the end of the first quarter here. The number of patients is sitting right around 2,400, 2,500 patients that are in the system at this point. For us, we're growing, as I mentioned before, in that trial prospect. So having opportunities to talk to folks and get them to come in clinic, not when they're sick. We are, to a certain extent, we're there to help America, but we are a benefactor of the pandemic because people come in and it gives us our chance to get trial. And so, we are anticipating and we're preparing for another outbreak of the pandemic, as Dr. Fauci has been talking about, given what's happened over in Europe and in Asia. It's a bad thing for everybody, I have to admit, but at the same time, we will see a benefit from that because it'll allow us, again, to accelerate those 15-minute appointments, and it will allow us to start building more relationships with more people as we open more clinics faster.
Okay. Pat Graves asks, are you experiencing any challenges hiring staff? And why would a nurse practitioner want to work for the Good Clinic?
Really good questions. And I mentioned earlier, there are so many nurse practitioners, 30,000 that are graduating each year. So finding nurse practitioners has not been a problem. The LPNs, the RNs, the client care coordinations, just like everyone else, we're having to be creative on how we bring people in to staff. The neat thing is we're kind of new and different, and it's a fun place to work. It's a satisfying place to work because it's not about being on the treadmill. One nurse practitioner I was talking to worked at one of my competitors, said she had to see 27 people a day. That was her requirement. In an 8-hour day, how do you do that? Really, are you providing good care? We're focused on minutes of care. And that is a real appeal to everyone in our organization. One of our shareholders stopped by one of our clinics and saw no one in the waiting room. Why don't you have people in the waiting room? Well, because I scheduled an appointment. Why would you be sitting out there? If I'm running on time and delivering a 30-minute or 60-minute appointment, I shouldn't have many people in the waiting room at all. So we're really thinking about how do I manage it so the experience is positive. Positive experience for the consumer means a positive experience for employees. And so our employees, first off, every employee gets stock options in our company. So everyone participates in the success. That just like every shareholder, they win when you win, when I win. And the other thing is the nurse practitioners, unfortunately, when they're working in health systems, they're practicing under the tutelage of a physician. When they work for us, they are an independent nurse practitioner. They get to practice. All too often in so many health institutions, they're not allowed to use their full education. Nurse practitioners are taught about complementary and alternative medicine. They're taught about vitamins and supplements and meditation and yoga and the benefits thereof, but they're not allowed to talk about it either because the time they don't have or because it's not allowed. For us, we let them practice the way they need to practice. It's what consumers want. And if a consumer is open to Eastern Western medicine, they are able to educate them and share those alternatives.
That's great. Oscar Moran asks, what are the economics behind opening a clinic?
Well, if I'm understanding the question correctly there, we talked a little bit about, a clinic. It costs us about $1 million to open a clinic. And it takes us about 10 to 12 weeks to build that clinic from building permit to certificate of occupancy. And sometimes you run into problems with cities and you struggle to get those building permits and accommodations for having a clinic. We are locating them in retail settings. And that's kind of a new thing for a lot of cities. And so sometimes they're taking a double look at the building permit to see that. So sometimes that delays the process there. But then, as I mentioned before, the economics, we expect a clinic to generate about $2 million in revenue on an annual basis and generate a 20% EBITDA. So once we get that clinic up and running, that capital that we use gets paid back pretty quickly, and we're able to use that free cash flow to generate either more clinics or buy other businesses and keep the business growing and the company growing.
Great. Tyler Howell thanks you for a very nice presentation and said, you mentioned offhand towards the end that capitalization to keep expanding. Do you have plans for an offering or dilution of stock or other means of acquiring funding?
Yeah, obviously, as we talked about, building clinics is our CapEx need. And at $1 million a copy, if we want to build 50 clinics, that's $50 million that in essence we have to raise in anticipation of the cash flow starting to take care of that. So for the business, we are very sensitive to dilution. And as a significant shareholder myself, all the employees here are shareholders. We are very sensitive to that fact. So as we mentioned, we have an S1 that's filed. We're getting ready for an uplist to NASDAQ. We will be raising some money there using equity. We're going to keep it on the smaller side. And I anticipate after that, we are going to convert to more of a debt structure. And we are already looking at using things like baby bonds and perpetual preferreds, which have been successful for other companies similar to us in the healthcare space, with the whole goal of being able to support the growth in the build, have the flexibility to pay it off when we don't need it anymore because we're generating revenue, but also to make sure that dilution is held to an absolute minimum.
Great. Jacob Morley asks, do you have an uplist time frame? Early investors appreciate you looking out for them.
Well, thank you. Yeah, we're working. We have our filings. We filed our proxy yesterday, a revised permanent or final proxy, and then we have the S1 We have an amended S1 out there right now. We will be filing another amended S1 here shortly. And I anticipate that in the next month, we will be successful with that uplist. Obviously, you know, the SEC, NASDAQ, and FINRA all have to weigh in on everything. The questions that we got back on the last S1 were pretty much de minimis. And so I'm not anticipating much of a delay with regards to the regulators. I think we're pretty ready for this. So I think, you know, in the next 45 days that we should be successful with this.
Great. Richard Smith asks, how does MITI compare to OSH or ONEM?
You know, that's a great question. We talk about this all the time. You know, you think about One Medical, Oak Street Health, you know, they got their starts from private equity. They got huge slugs of capital to get out there, to build. They hired huge staffs, and they got into market. They came public at unicorn valuations. We're the exact opposite. We're a bootstrap startup public company. Investors usually don't have an opportunity to get in with something like this. And so we are very thrifty in the organization. We're very cognizant of every dollar that we spend. And, you know, we're building little by little by little, being very selective on where we spend. Sometimes our PowerPoints have spelling errors in them. Thanks to all the shareholders who commented. We're making those corrections. If I could use you instead of spell check, that'd be great. But it's we are very cognizant that this is our shareholders' money, and we will be operating very differently, focused on the consumer and building this business brick by brick by brick. And we think the market will respond favorably towards that strategy. Wonderful. Larry, do you have any closing remarks? Well, I appreciate everyone taking the time today to participate, learn about Mitesco, and look forward to the next one and updating you with each step in the progress that we make. Wonderful. Well, thank you so much for your time and a great presentation. Please join us again in the future with your updates. Thank you. Bye-bye. All right. Well, everyone, it's been a great conference today. Thank you so much for joining us. Remember that in just a moment, you'll be redirected to the registration page for the next conference. Please stay on so you can reserve your spot early. And on behalf of all of us at the Emerging Growth Conference, we'd like to thank all of our presenters and everyone watching so we can make another Emerging Growth Conference such a great success. And remember that a complete replay of this conference separated by company will be available on the Emerging Growth Conference YouTube channel, youtube.com/Emerging Growth Conference. So please subscribe. Also subscribe to our Twitter. That's @EmergingGrowthC. We always post new information to Twitter first. So I'm Anna Berry. On behalf of myself and our entire team, we want to thank you all for joining us, wishing you a healthy, happy, safe, and successful 2022. And we'll see you back here next time. Thanks for watching.